It's high noon, so what do I say? I can't say good morning, I don't say good afternoon. Good day? Good day. And welcome. Thank you everyone for being here. Welcome to the White House. I'm Douglas Brooks. I'm Director of the Office of National AIDS Policy. Thank you. And on behalf of our office and the Office of the National Drug Control Policy, welcome to our observance of World Hepatitis Day 2014, where we'll celebrate the advances we've made in addressing viral hepatitis in our country and around the world. I first want to recognize a few leaders in the room. Members of the Congressional Hepatitis Caucus, Congressman Mike Honda is here. Congressman Honda. Our partners at HHS, Assistant Secretary Dr. Howard Koh. Deputy Assistant Secretary Dr. Ron Valdesari is also here. Our most fabulous and tremendous Global AIDS Coordinator, Ambassador Debbie Burks. And Dr. Paul Farmer is also here, all of whom you will hear from today. I also want to recognize Dr. Jonathan Merman and Dr. John Ward from CDC's National Center for HIV/AIDS, Hepatitis, STD, and TB Prevention, who lead the CDC's commitment to addressing viral hepatitis. So thanks for those guys. Last year, we co-hosted this event for the first time with our colleagues at ONDPC because we recognized that neither viral hepatitis nor HIV exist in a vacuum. They are conditions that intersect with the realities of people's lives, including injection drug use, which places people at higher risk of being infected with both viruses. And now, moving forward, with the tools that we have, with vaccines for hepatitis A and B, with better and less costly screening tools, with a brand new and super effective curative treatments for hepatitis C, we ask ourselves how we can advance the goals of our updated viral hepatitis action plan. We ask how we can reduce co-occurring infections, and we ask how we can bring to scale and synergize our efforts to provide access to screening and treatment for people across the globe. Those are questions we'll explore today, both as they impact us in the United States and in our global partner countries. Today's theme is recognizing leadership. We'll recognize leadership in the community, in research, in clinical science, in global health, and in government. And while we recognize leadership in the progress we've made in recent years, we also must recognize that still nearly 400 million people worldwide live with viral hepatitis. To get us started today, allow me to introduce Christine Harley, Senior Policy Advisor for the White House Initiative on Asian Americans and Pacific Islanders. Christine.
Thank you, Doug. Happy World Hepatitis Day. I am so honored to be in a room of such important champions in the fight to eradicate viral hepatitis. And a special congratulations to the 14 leaders who are being celebrated today. In particular, I would be remiss if I didn't acknowledge Dr. Howard Koh, the outgoing Assistant Secretary for Health at HHS, who has served for the last 5 years. As you all well know, Dr. Koh has been one of the most influential leaders in the Asian American and Pacific Islander communities, viral hepatitis, and public health communities throughout his career. And sadly, this is his last week in his current position. So I just wanted to give a round of applause, please, to Dr. Koh and all of his great work. The White House Initiative on Asian Americans and Pacific Islanders is dedicated to increasing access to and participation in federal programs and services. And in particular, we view the partnership with community groups and our federal agency partners as a key element behind many of our successes, which is why Dr. Koh has been such a strong asset to have at HHS. In one of his many important acts, Dr. Koh recognized that hepatitis B was a major health concern for the Asian American and Pacific Islander community and was a driving force behind the development of the action plan for prevention, care, and treatment of viral hepatitis implemented across HHS. And I think what is really critical about this plan is that it accomplished 3 things. One, the action plan is the nation's first comprehensive cross-agency effort to combat viral hepatitis. Two, Dr. Ko helped ensure that key components of the action plan were also included as a core element in HHS's action plan for the White House initiative on AAPIs. And third, the action plan provides a platform and a tool for all of you who represent the leaders and individuals across the country who have made tackling this preventative disease their life's work, to work in concert with HHS to make sure that our public and private efforts are aligned and coordinated, which has, I think, tremendously helped us move this conversation forward. And so once again, I am so honored to be here, and thank you all so much for what you have done to advance this important issue. And now, although I'm sure he requires no introduction, it is my pleasure to introduce another champion of the viral hepatitis community, Congressman Mike Honda. Congressman Honda represents the 17th District of California, the only majority AAPI district in the mainland USA, and he is the Chair Emeritus of the Congressional Asian Pacific American Caucus. And because hepatitis B has been such a critical issue in the AAPI community, this has driven his commitment to hepatitis advocacy. And so as a founder and co-chair of the bipartisan Congressional Hepatitis Caucus, the congressman has introduced several pieces of legislation that have been very important to focus on increasing hepatitis B and C prevention, testing, and education efforts. And as a senior member of the Appropriations Committee, Congressman Honda has advocated for increased funding for all of these important programs, especially the CDC's Division of Viral Hepatitis. Currently, the congressman serves as an at-large board member on 2 local hepatitis B initiatives in and around his district, demonstrating again his commitment to serving the people of his district. So thank you, Congressman Honda.
Well, good morning, everybody. That's pretty good. As a founding member and a co-chair of the Congressional Hepatitis Caucus, I thank President Obama for issuing the 4th Presidential Proclamation for World Hepatitis Day. This presidential proclamation is a special reminder for how far we've gone, but also it reminds us how much more we have to go. Viral hepatitis affects 1 out of every 12 persons around the world and is responsible for 1 million deaths each year. In the United States, it's estimated that as many as 5.3 million Americans are living with viral hepatitis, with up to 75% of them unaware of the status and not seeking treatment. Importantly, the prevention of chronic hepatitis B and hepatitis C serves to prevent liver cancer, because these diseases are the leading causes of this type of cancer throughout the world. In the last 4 years, so much progress has been made. We now have an action plan from the Health and Human Services, more robust screening guidelines from the U.S. Preventative Task Force, increased funding, like an additional $9 million in the FY 2014 Omnibus, like advocating for $80 million in the Viral Hepatitis Testing Act, which has over 50 co-sponsors now, and $47.8 million in the FY 2015 appropriations, and then also a greater public awareness. We also recently hosted our 2nd Congressional Hepatitis Testing Day event on Capitol Hill with a committed bipartisan group of champions in Congress who want to see this problem through. Congressman Dr. Billy Cassidy, who is a hepatologist himself, cool, and what's even more cool is that he's a Republican, so we got bipartisan activity here. And Congressman Hank Johnson, and also Congressman Charlie Dent, who also is a Republican. So we really have a great bipartisan team here that's moving forward. But our work is not done, which is why I remain still committed to passing the comprehensive legislation to deliver real funding for testing and education. The Viral Hepatitis Testing Act will create the first coordinated national system to address and combat viral hepatitis. And I want to thank our champions in the hepatitis community for their great leadership, their instruction, and the Obama administration for the progress it has made through interagency teamwork. And that word, interagency teamwork, is the term I heard from Dr. Koh when he first opened up our first across-the-board meeting. And prior to that meeting, he said to us, before this meeting, in order to prepare ourselves, I've had about 2 to 3 interagency team meetings. And I said to myself, cool, you know, Co is cool, you know? And, you know, so it really brings up the whole idea that he gets it. He's not only a leader, but he's also a teacher, and he understands the concept of pulling all kinds of people together to make this thing happen. And he hasn't lost his touch or his thought or his vision, or he hasn't missed a step in this whole process. You know, instructing the policymakers, working with our staff, and making sure that we all move forward together under the same tune. This all started for me with Dr. Sam So, who is here also. Sam, you want to stand up for a second? Yeah, thank you. The difference between Dr. So and Dr. Ko is taller. So I wanted him to stand up, you know, so you could see him. But it was about, 6, 7 years ago. I visited Dr. So's leadership class at Stanford. He had something like 300 young people from across his country. And sitting in the back, I was listening to him, talking to these youngsters and telling them they had a leadership role now because they understood and they know about hepatitis, the viral hepatitis issue, and that it was their job now to go across the country to work on this issue. And I sat back there thinking, okay, I'm learning, but my job is to be the policy person. But I had to learn more. And as I learned more, I understood that I should be tested because I didn't know whether I had it or not. And I'm an Asian male, and I'm at risk at a very high rate, and I travel to Asia a lot. And so reluctantly, but I had to tell myself, I gotta do this. Because you can't ask anybody else to do it if you don't do it yourself. So I did it, and along with a friend, Fiona Ma, who was at that time, she was a pro tem, speaker pro tem at the California Assembly. We both did it. I came out negative. But then that wasn't the end of it. I knew that through the instruction that I had to do the series, 3 more shots, and I did, and now I can say I'm immunized, but there are a lot of people who are not, and so it became incumbent upon me to take the word forward and spread it and make sure that this country moves forward on this very critical issue. My friend Fiona found out she was a carrier, and she thought that a carrier, from her mother's instruction, that it's okay, you're being a carrier, it's not dangerous. And she was told by Dr. So, no, that's not the case. You got to get tested more and find out. And so she did, and she's now in maintenance and taking care of it. And her mother was the same thing. And she had to talk to her mom. And they found that when they tested her again, that there were small dots, and there was indication of something occurring. And they took care of that. So as a result, that whole action saved 3 lives. The thing that happened afterwards, when I got together with some of the people at the health fair, I ran across another gentleman who was just beside himself, and he found out they had chronic liver condition, and then he's going to need a transplant. And so understanding that and then extrapolating it across this country and this world, and talking about how the silent killer is really silent and it needs to be exposed, that our bill becomes important because it's a mandate to CDC to educate, to prevent, and to eradicate the viral hepatitis. And I can't think of anything better to do than to move forward for the betterment of this, not only for this country, but for the global actions too. And so to all of you who are teachers, thank you for teaching me. For all of you who are leaders and policymakers, thank you for doing that. Because together we can move this country forward. and truly be able to say that we got it under control and we're going to eradicate it. So for those reasons, I just want to say thank you to you for the work that you're doing and you will be doing. And to Dr. Coe, yeah, you'll be leaving, but you left behind a lot of extra work that we have to do, and we know what we have to do. We have to complete it, right? And so when you come back and you say, the final examination's coming up, we'll be ready. And where you're going, I understand that you're going to be able to have an opportunity to continue to spread the word and teach, and hopefully generate more folks like yourself and like Dr. So. So again, thank you for your work. Thank you all for your work. Thank you.
Thank you, Congressman Honda, for being here and for your commitment throughout the years. And, you know, I think you acknowledged folks who are teachers. I think in a very short period, you actually taught us too, just now. And I think you reminded us of the stigma. You reminded us of fear that, you know, in a lot of our work, we talk about folks and why they don't get tested for hepatitis, for HIV, for various conditions. And sometimes it's just because they're afraid. So thanks for reminding us of that and of the importance of accurate information. So we're going to move on with the portion of our event on leadership and addressing viral hepatitis today, domestically and globally. But I think this next person needs no introduction, but I will ask you all to please stand and join me in welcoming Dr. Howard Coe to the
Thank you so much. Thank you. Please sit down. Thank you. Please sit down. Boy, I'm really going to miss this. You guys are great. I was thinking as we were assembling here that this community didn't really exist even just a couple of years ago, and now we have this really very vibrant national and global community that cares so deeply about this issue. So I'm absolutely delighted to welcome each and every one of you here today to tell you how much I respect and appreciate each and every one of you. You are all heroes to me and leaders to me, and it's so special to join in and join hands with literally millions of people around the country and around the world on World Hepatitis Day. What we're doing today is adding our voices to the many who want to break the silence, and it's long overdue because this is an issue that really affects millions and millions across this globe, as you have heard. But we are so inspired by the leadership and passion of so many of you who are here and many others who are joining us by a webcast. First, I want to express my great gratitude to Congressman Honda. I think Mike Honda is cool, don't you? Another round of applause for Mike Honda. The Congressman is a tireless champion on so many issues, and to get to know him and to feel his passion on this issue and his whole commitment to public service is something I treasure. So, Congressman, thank you so much. I'm going to miss you dearly. I want to thank our White House. We have a White House that's absolutely committed to this issue and so many other public health issues. You've already heard from my good friend Doug Brooks from the Office of National AIDS Policy. Doug is from Massachusetts, so we've known each other a long time. I want to thank Mike Botticelli from the Office of National Drug Control Policy. Mike is my former chief of staff when I was health commissioner in Massachusetts, so we go way, way back. Mike, we're very, very proud of you. Thank you for your leadership. We're thrilled about the progress of the White House initiative on Asian Americans and Pacific Islanders, Christine Harley and Kiran Ahuja and many, many others. So thank you to the White House for giving us this beautiful space and hosting this event. And then this is a global effort, and I want to thank Ambassador Debbie Birx and the whole Global AIDS Office who have embraced this issue because it's so closely linked to HIV/AIDS. And I want to thank my good friend from Harvard, Dr. Paul Farmer, who is here today from Partners in Health. Looking forward to his presentation. And Paul, looking forward to joining you back in Massachusetts pretty soon. We have a wonderful panel coming up. Dr. Gottfried Hernschall, Dr. Sam So, the very tall Dr. Sam So that you have already met, Mr. Michael Ninberg, and Dr. Jennifer Havens. These are all passionate, very brilliant colleagues, and we're thankful for your leadership and commitment. And then I want to express my gratitude to my colleagues at the Department of Health and Human Services, Dr. Ron Valdesari and Karina Dan. They have helped put out the second version of this viral hepatitis action plan. You each have a copy of this. And we are very proud that, as the Congressman alluded to, that this brings together not only Health and Human Services, but also Department of Justice, the VA, Housing and Urban Development. Ron and Karina, can you just stand up and get a round of applause here? We have many wonderful colleagues from the CDC, Dr. John O. Merman and my wonderful colleague, Dr. John Ward. There is a story that you may have heard, but I want to say it again here because it's so appropriate. The action plan started with a phone call from Dr. Ward to me through our mutual friend, Rosie Henson, 4 years ago, and that one call stimulated this national effort. So where's Dr. John Ward? I just want him to stand up and get another round of applause here. There he is. And I know so many of you here, I wish I could brag about each and every one of you, but there are two very, very special people here that I want to introduce. My wife, Dr. Claudia Arrig, and my son, Stephen Coe, an international lawyer, if I can stand up. You can tell it's my last week, right? That's what. So I am so proud of each and every one of you because you are leaders, you are heroes, and you're adding your voice to an area where there's been silence for far too long. You've heard from the congressman that some 400 million people are affected around the world with chronic hepatitis, over 1 million people dying each year, up to 5.3 million Americans living with chronic hepatitis B and C. And the tragedy is most of them don't even know it. So we have some very basic work to do with respect to screening, testing, and awareness. We all have heard too often how hepatitis fuels liver failure, liver cancer, liver transplantation. And then, of course, there are terrible disparities that are involved in these statistics. Martin Luther King once said that he wanted every person enjoying what he called the sunlight of opportunity. I love that phrase. And for health, we want everyone to enjoy the sunlight of opportunity. But for hepatitis, we know that hep C is twice as common among African Americans compared to the general population. And for hepatitis B, half of the US population chronically infected with hepatitis B are of Asian American and Pacific Islander backgrounds. So these are disparities we need to eliminate once and for all. And we still have some basic challenges. For example, each year still we have some 750 children born to hepatitis B positive mothers, and they will go on and develop chronic hepatitis B. That number should be 0, and we need to improve the birth dose efforts across this country to reduce mother-to-child transmission. This is an entirely preventable epidemic. But we are here today on World Hepatitis Day because in a short period of time, we've built this great community, and we've accomplished a lot. And I like top 10s. I don't know about you, but I'm going to run through my top 10 accomplishments that we can all celebrate today on this very important global event. Number one, we have this second version of the viral hepatitis action plan, which has literally galvanized our community, and we're very, very proud of it. Number two, we have recently, over the years, established a National Hepatitis Testing Day, May 19th, here in the United States, just to send the basic message that people should know their serostatus, in a way explained so beautifully by the congressman. Third, you all know that we now have new hepatitis testing recommendations from the CDC and U.S. Preventive Services Task Force. For Hep C, new so-called baby boomer testing recommendations for people born between 1945 to 1965. because that age group is 5 times more likely to be infected with Hep C than others. It's been projected that this single advance in screening will save more than 120,000 lives, so we're very, very excited about that. And then just this May, in 2014, new recommendations came out from the U.S. Preventive Services Task Force to test all individuals at risk for hepatitis B, including people born in countries with 2% or greater prevalence. So that, again, brings more people into this conversation, raises awareness, and facilitates early detection. Number 4, we have wonderful new targeted outreach educational materials for hepatitis B and C. As an Asian American and a son of immigrants, I'm so proud to see a number of these are translated into foreign languages, particularly of Asian background. Number 5, we have greater attention to this epidemic of Hep C among people who inject drugs. There are many people here who deserve tremendous thanks for that whole effort. Number 6, we are working to oppose discrimination against people with chronic viral hepatitis. And as an example, just last year, the Offices of Civil Rights from the Departments of Justice, Education, and Health and Human Services sent a joint letter to health profession schools with a new CDC guidance on the management of healthcare professionals and students with chronic hepatitis B. So we're very proud of that. 7, as I alluded to, we need to eliminate perinatal hepatitis B transmission, and we are well on our way. Number 8, we're hearing almost every day about exciting new treatments for hepatitis C that are leading to drugs that are approved by the FDA that are simpler, shorter in duration, and have fewer side effects. And the dramatic advances in cure have been so exciting to see more than 90% of patients who are completing treatment and often moving on to cure because of these new interventions, so we're very, very excited about that. Number 9, of course, we're living in the era of health reform. 2014 is the year of full implementation of the Affordable Care Act, and now health insurance companies are required to cover people with pre-existing conditions, including chronic hepatitis B and C. And then, of course, number 10 is what we're doing today, celebrating World Hepatitis Day here in the White House. And our president has issued World Hepatitis Day proclamations, and he and his team have hosted these events here in the White House for the last several years. None of this existed just several years ago. And this is what you all have created as leaders and heroes. So I'm so, so proud of you. And if I can say on a personal note as I end, I am now completing 5 years and 1 month as Assistant Secretary for Health. It's been the honor of my life to be in public service. It's been a life-changing experience to meet with all of you and so many others to make our country and our world healthier. It's very appropriate that this event is my last public event as the Assistant Secretary for Health. It all somehow makes sense to me. So I am standing before you with tremendous gratitude in my heart and tremendous respect for each and every one of you and tremendous appreciation for the journey we have all taken together. So thank you all very much. God bless you, and I love you all. Thank you.
Thank you, Dr. Koh. And as Congressman Honda said, you've mapped the path for scaling up our efforts to address hepatitis in the United States and globally, and that legacy will live on. Next, Ambassador Deborah Birx is the United States Global AIDS Coordinator, and her portfolio is the entire PEPFAR program. Prior to this recent appointment, Ambassador Birx served as Director of CDC's Division of Global HIV/AIDS, where she utilized her leadership qualities, superior technical skills, and compelling passion to achieve tremendous public health impact. Today, she will show us PEPFAR's commitment to addressing viral hepatitis through its programs and partnerships. And on a personal note, I call her DB1 and I'm DB2. DB1.
Thank you so much. And Thank you, Dr. Koh, for your leadership. And we're recognizing leaders later in the program, but I just want to use this opportunity to recognize why we have been successful within PEPFAR. And it's been a combination of extraordinary White House commitment and leadership, and extraordinary leadership in a bipartisan way congressionally that has supported us every step of the way. And I think having that White House and congressional leadership has really been extraordinary and so important to what we've been able to achieve. Now, I also know John Ward, who was constantly in my office over the last 9 years while I was at CDC saying, why aren't you doing more for hepatitis? You need to do more for hepatitis. So thank you, John, and thank you for always pushing that issue. He was a loud voice for a long time about why this is important, and it was based on his voice that PEPFAR changed a lot of its guidelines and focus. So thank you, John, and thank you to everyone else in the room. So if we could just go through some slides very quickly. Next slide, please. PEPFAR has been focused on saving lives now for more than a decade. What's been exciting for us, and as you've heard from the hepatitis story, the saving of lives has translated into changing the course of the pandemic. And we're very excited about HIV being a smaller pandemic today than it was even just 10 years ago. Next slide. So we've had unprecedented success under this administration. We've made great progress. We've tripled the number of people on life-saving drugs, and that's been very exciting for all of us. And as Secretary Kerry announced just a year ago, we had the millionth baby born HIV-free. And hearing you talk about immunization for hepatitis B, so essential to be able to reach mothers about these issues. We recognize that circumcision was a very important piece, and we're so lucky to have the NIH right down the street guiding us, paying and funding these incredible research opportunities that then we can translate into these programs like PEPFAR. But importantly, and you'll see down towards the end, almost 60 million people were tested last year under PEPFAR for HIV. And part of that testing went to testing for co-infection. So we've been very grateful. Next slide. And this is just again recognize President Obama's call to action to an AIDS-free generation, which is an incredible goal. And I think you've also heard from UNAIDS a real call to control of this pandemic. And so we're in a very different place than people would have thought we could achieve in just a decade, and it's really because of this global leadership around this opportunity. So next slide. On the verge of the African Summit and a joining of many African leaders, and we have the young African leaders here this week and heads of state next week, talking about economic growth and development in Africa. Part of that is being driven from the investment we've made in the Global Fund and PEPFAR and the reversion of the dismal life expectancy that occurred a couple of decades ago, with losing two decades of life and people being infected during their most productive years of 25 to 45. And the reversion of this now with the investment we have made and return to work. So thank you all for the work that has been done in HIV/AIDS, and I see some of the HIV leaders here. Next slide. And this is translated, this is the trend in new HIV infections, and the big blue area is sub-Saharan Africa, but you can see similar gains have been made across every one of the regions, and this is an exciting time for us to finish the job. Sometimes when things start going well, we get a little distracted and feel like we've won, but we have not won in HIV yet, and we have work to do. So next slide. Turning to viral hepatitis and its serious public health threat. Next slide. This is a great West African proverb that says, a pregnant man delivers in his grave. And these are representative pictures of people with chronic hepatitis and ascites and dying, and really recognizing the importance of this infection around the globe, including sub-Saharan Africa. Next slide. And the number of deaths from hepatitis B and C will soon exceed the number of deaths from HIV. And so we all have to take this as a very serious time. And next slide shows the co-infection of HIV-positive patients with hepatitis B and hepatitis C, something that John Ward told me every day. He was very close. I could look into his office when I was at CDC. I knew what he was saying to me, that private communication, but we know that HIV accelerates the progress of hepatitis B and hepatitis C. And this is really a significant point for PEPFAR because 50% of the 35 million people with HIV are under care under PEPFAR and funded for care under PEPFAR. So this is an important rallying call for all of us. And next slide. So what are our opportunities for supporting co-infection? Next slide. We've had excellent leadership from the Secretary of State, both Hillary Clinton and now Secretary Kerry, really funding not only these core programs, but the innovative implementation science research that needs to be done in conjunction. And during the during the AIDS conference 2 years ago, Secretary Clinton announced these 3 new initiatives to really work more effectively among vulnerable populations and ensure that we were dealing with the issues related to stigma and discrimination and fear, frankly, that were keeping people from coming in and being diagnosed. So one of these is, the first one is looking at bloodborne infectious diseases, including hepatitis, a challenge grant really looking at people who inject drugs, both in Ghana and Central Asia, and the Robert Carr Civil Society Network Fund, which we're very excited about, funding advocacy and activism around these core causes to get leadership recognized in countries. If we had the same White House and congressional leadership in many of the countries we worked, we would be able to tackle these public health threats in a much more direct and aggressive way. Next slide. Just wanted to give you some ideas recently published in the MMWR, a CDC publication, showing the percent decline in hepatitis B prevalence among blood donors. PEPFAR is funding the majority of the blood donation sites in Africa, increasing both the number of units available for life-saving interventions, and also screening that blood for HIV, hepatitis C, and hepatitis B. One of these interventions of Dr. Ward, who said, you can't be out there just screening for HIV. Even though it's just HIV money, you have to screen for hepatitis B and C, so we did. And that's why we're able to have this data today that really shows this dramatic change in a whole series of countries in hepatitis B infection in the blood units. So we're excited about the progress is being made, but obviously much more work to do. So what could we do together? Next slide. We're really looking at how we could improve our surveillance and how we could use the HIV surveillance activities to improve our surveillance in sub-Saharan Africa and other resource-limited settings, continuing to do the blood banking work and following these trends because we think that's very important. A series of prevention activities to promote safe injection and blood safety programs, as well as universal access to the screening of HIV, hepatitis B and C, and syphilis. We have work to do there still. Our peer education and community outreach, we know that we will only be successful when communities are engaged in the process, and that's part of the Robert Carr Foundation, and then integrating other preventive and comprehensive educational and prevention strategies within our work for HIV, for also the hepatitis. Next slide. And then what can we do more in care and treatment? We are excited about the advances that you all have made because we don't have a cure in HIV. We have a roadmap to a cure. We have people excited about a cure. We have NIH investing in a cure and also vaccines, but we have neither a cure or a vaccine. And so we're excited about what you have and what we could bring to bear in a collaboration and what we could do in a partnership to actually ensure that our HIV positive patients are receiving appropriate treatment for hepatitis B and C, and that also we do more screening in this area. Now, this is a daunting piece that we will have to work together in partnership as more drugs become available. Next slide. So I just wanted to go through what we had learned in the last decade of PEPFAR that we think could be translated into the global hepatitis network. Next slide. We have supported a very specific public health approach. And what does that mean? We try to keep it simple. We try to implement the WHO guidelines in the most simple and direct way that we can, and it's great to have Godfrey here today, and he'll be talking a little bit later. Next slide. But I think some keys to our successes has been to keep it simple to affordable and effective regimens so countries can deploy them in a very aggressive way. To streamline approaches to our laboratories, so we've been doing a lot in laboratory development, a lot in blood bank development, and making sure that we've kept the laboratory commodities streamlined according to the national strategy. And importantly, task shifting. Some of the best HIV doctors that I have seen in sub-Saharan Africa are what are called nurse prescribers. Nurses that have stepped forward to learn the care and treatment of HIV-positive patients and are actually becoming their primary caregivers and the primary clinicians in sub-Saharan Africa. So this kind of task shifting has been key. And the next slide. We've translated this into improving our accountability, transparency, and impact. And if you go to pepfar.gov today, you'll be able to see all of our investments on the public site by country and our achievements. So our budgets and our achievement, you can go right in there and find out how much we're investing in blood safety and what our achievements have been in blood safety. And we wanted to make this available universally so that people could start analyzing our data and help us and say, you know, I have something that I learned from going to your website and I think you could do this better. And we really want to hear from you and we want to hear how to do things better. And just to conclude with the next slide. We have been focused very much in these 5 pillars, and one of them is an impact agenda to make it clear that we're having a direct impact on controlling the pandemic. The president has called for an AIDS-free generation, and we need to demonstrate that we're achieving it. And so we've moved from just inputs and outputs to outcomes and impacts. We've developed an efficiency agenda where we're taking expenditure analysis down to the site level and linking expenditures with effectiveness and with the achievements at the site as well as the quality. A sustainability agenda working in partnerships with countries to really increase their awareness and investment in these core public health endeavors. A partnership agenda to show that we are serious about working. We are already interagency and work very well across all of the agencies, but we need to work more effectively with UNAIDS, WHO, the World Bank, and Global Fund and our partners that are doing extraordinary work. And finally, one of our absolutely key pillars is this human rights agenda, because we are very concerned about some of the dark clouds that are gathering over Africa that would further stigmatize populations and make it less able for them to access life-saving services. And we're committed to address this in a proactive way, as well as working in countries where it's already a problem. And next slide. So as Nelson Mandela says, it always seems impossible till it's done. And I tell you, at times I've thought some of these things were impossible. When the president announced 4.7 million circumcision as part of our World AIDS Day targets in 2011 and said, you have 2 years to achieve it, I really got a little nervous. But it has given people a real rallying call, and we achieved this. And we achieved it because we have great partnerships both here and in countries, working with partners like Partners in Health and working with ministries of health to ensure this happens. And it's been really tremendous to be part of a program that translates the president's vision with funding from Congress into a program that's been so successful and part of what American people do best. So thank you.